My healthcare journey began as my family got older and began to decline. Um, I remember my mother in her end stage of cancer. She was in a nursing home before we could get her into hospice. And they scheduled a meeting. I attended. They didn't bother to tell me that the meeting was canceled. I was furious. And then I walked by this woman who wasn't my mother, who was screaming for her daughter. So I became an advocate for this other woman. I mean, our healthcare system does not take care of our elderly. It doesn't take care of our teens. It doesn't take care of our transgender folks who have and our mental health issues. Well, let me digress. But as I began taking care of my mother, I noticed that if you don't have an advocate, you're sunk. If you can't speak for yourself, I then ended up with breast cancer again. So that was the second time I got breast cancer. So I had to become an advocate. A doctor told me I wasn't going to lose my hair. And I said, okay, because I'd already lost my hair once. And what she should have said was, the majority of people don't lose their hair. The majority of people can work. I lost my hair. I was incontinent a lot of the times. I was miserable, but I was going by what this woman said. And healthcare professionals need to be really careful when they say things. I mean, the whole thing with going to a learning institution, you first get checked in by a nurse's assistant. Then you get checked in by a nurse. Then you get checked in by a resident. And then you see the doctor. That's 4 people you're explaining yourself to each time. So if you don't speak up and say, I don't want to talk to all those people, I just want to talk to the doctor, they're going to make you do that each time. So I began to become an advocate for myself. And then after that, I ended up with leukemia. So I then was in the hospital for 4 months. You learn a lot about the healthcare system when you're in the hospital that long. You can't get better without the little people in that hospital. Yes, I saw the doctor, but the people who took care of me were the certified nursing assistants. They were the nurses and the nurse practitioner. Even the housekeeping lady, she came every day. She said, Miss Lyn, I'm gonna make sure your room is cleaned up. That was something that was so important to me. I just look forward to seeing another person. I was in isolation. I couldn't see my family when I wanted to see them. So it was another piece. But if you don't advocate for yourself, there's something called a hospital ombudsman, that if you're in the hospital, you can ask for that person and that person will come in and talk to you and make sure you get what you want. So the healthcare system, it is not, if you don't know these things, you don't know what you don't know until it happens.